Welcome back. Good to have you along as always for Ozarks Tonight. I'm David Oliver. Again, as we all are living in these uncertain times right now with regard to the COVID-19 pandemic across the world, we're socially distancing ourselves from people. We're finding ourselves in more isolation than we have ever in our lives. And we have to think about our mental health. We wanted to get some perspective tonight to maybe help you with some of those ways to get through this from the mental health perspective. We're joined by Dr. Kyle John, who is a psychiatrist at Mercy. He's also the medical director for Mercy Behavioral Health. Dr. John, good to see you again. We've had you on before. It's good to see you again.
Oh, I'm glad to be back, David. Thanks for inviting me.
I'm asking a lot of my guests this same question off the top. How are you doing, first of all, in this, and how is your practice going? Are you seeing patients?
That's a great question, and like a lot of my colleagues, we're all shifting from face-to-face visits to virtual visits or some sort of telemedicine. So if possible, I'm encouraging my colleagues and my patients, hey, try to set up a telemedicine system, and there's lots of creative ways to do that so that folks can decrease their risks of getting out and traveling, especially to a hospital or clinic. Those areas can cause high anxiety for folks. So we're really turning to virtual telemedicine these days. That's actually part of my job here at Mercy, as I work at the Mercy Virtual Care Center in Chesterfield, and I can do that job virtually, and so that's what I've been doing recently.
Okay. Let's talk about mental health, and let's talk about how we're all doing. We were all cooped up inside. People are trying to stay home as much as possible. Give me, if you can, in a nutshell, some of the top things we can be doing to help ourselves right now, help our kids, help our loved ones.
Yeah, that's great. And I'm glad you called out kids versus maybe our spouse or our parents, because everybody's going to react to this shelter in place and the anxiety associated with the COVID-19 in a different way. And so lots of things that we can do. If we start with kids, kids may show stress or anxiety differently than an adult. They might act out behaviorally. They may have medical symptoms like headaches or tummy aches, or they may show some insecurity and ask for some extra hugs or be a little bit clingy. And so kind of be on the alert with kids. Some things that really apply to kids, but also to us as adults, is keep them on a schedule. Give them something to do. Keep them active. Routines are comforting for most of us. And so while kids may resist a little bit because it's a different routine than when they are attending school in person, try to keep them on a routine and be active and creative with the way that you approach the day. So you might find opportunities for kids to be in control. Hey, what are we going to have for dinner tonight? What would you like to help prepare? And involve them in that activity. I know we're not supposed to be going out, but we can still go outside and by ourselves or in small groups. And so go out for walks and play that I Spy game as you're walking around your neighborhood and those types of things. But keep them active. Keep an eye on them in terms of they're showing any signs of stress. For our adults or even our older folks that may be dealing with some medical issues, these days can be really anxiety provoking because they're worried, what if I catch this virus? What effects will it have on my health? And is it even safe to go to the hospital? And so checking on our loved ones, our family members. I heard a phrase on the town hall last night, which I loved. It was physically distanced, but emotionally connected. We want to stay connected with our friends and family. And that's good for kids too, making sure they have a way to reach their friends on the phone or through some type of FaceTime or virtual device. Make sure you're staying connected to your friends and family. Reach out to them, ask them how they're doing. And there's some simple things, David, that everybody can do kind of to help their mental health. I'll give you some examples. Deep breathing is a great one. I heard a great analogy of using your hand and taking your finger and you breathe in and out and in and out. And you go across your 5 fingers, taking deep breathing, taking deep breaths. That's a great way, very practical. Even a child could do that. Your 90-year-old grandma can do that. So it's a neat little trick that we can do just to keep ourselves calm. Finding other ways to stay relaxed, meditate. Prayer is a great idea. And then exercise. You can stretch, you can do yoga at home. There's lots of programs on TV. Get in an exercise routine at home and get creative there, especially with your kids. What weighs a pound or two that they could pick up and do some exercises. So include some regular exercise or stretch in your daily routine. Of course, healthy diet, proper sleep, avoiding drugs and alcohol, always important, but especially important now.
We got about a minute left, Dr. John, and these are great tips you're giving us. And I would have to ask you, it's got to be more important than ever for us to follow these things right now, because even people who don't necessarily face mental health issues on a daily basis might find themselves feeling those anxieties and stresses now because of this uncertain time that we're going through.
Absolutely, and there's a lot of good resources. There are online resources. I mean, you can call your friends and family, but if you're really feeling stressed and it's affecting your daily functioning, reach out. Here in Springfield, we've got NAMI, Burrell, Mercy, Cox. There's always 24/7 the Suicide Prevention Lifeline at 1-800-273-8255. It's a great resource. I encourage people to put it in their phones now, because when you need it, you don't want to have to look for it. For our younger viewers, many of them prefer texting, and you can text the word START to 741-741. That's a great resource in a crisis.
All right, Dr. Kyle John, I appreciate your time joining us through Skype, which is a great way people can also stay in touch. I appreciate your perspective, and I wish you and your patients well over there at Mercy. We'll check back in with you in a couple of weeks and see how things are going, okay?
Awesome. Thanks, David.
Okay, thank you, Dr. John. We'll have more Ozarks Tonight after this quick break.